Welcome to today's microbiology lecture on meningitis and encephalitis. These serious neurological conditions can have severe consequences if not recognized and treated promptly. Throughout this lecture, we will explore the various pathogens responsible, antibiotic resistance challenges, viral encephalitis epidemiology, fungal meningitis, autoimmune encephalitis, neonatal meningitis, tuberculous meningitis, herpes simplex virus encephalitis, aseptic meningitis, viral meningitis outbreaks, neuroimaging, immunocompromised patients, and long-term neurological sequelae. Let's begin. Bacterial meningitis is a life-threatening condition caused by various bacterial pathogens, including Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza. The choice of antibiotics is crucial in treating bacterial meningitis, and unfortunately, antibiotic resistance has become a significant challenge in recent years. The lecture will explore the mechanisms of antibiotic resistance in these pathogens and discuss appropriate treatment strategies. Viral encephalitis refers to the inflammation of the brain caused by viral infections. The lecture will focus on the epidemiology of common viral agents such as herpes simplex virus, West Nile virus, and Japanese encephalitis virus, discussing their modes of transmission and geographic distribution. Moreover, we will delve into the concept of neurotropism, which refers to the tendency of certain viruses to specifically infect the neural tissues. Although rare, fungal meningitis can have devastating consequences. This lecture will shed light on the fungal pathogens responsible for meningitis, including Cryptococcus neoformans and Candida species. We will discuss the risk factors, clinical presentation, and diagnostic challenges associated with fungal meningitis. Furthermore, treatment options and prevention strategies will be explored. Autoimmune encephalitis is a condition in which the immune system mistakenly attacks the brain, leading to neurological symptoms. Interestingly, the clinical manifestations of autoimmune encephalitis can mimic those of infectious causes, making diagnosis challenging. This lecture will delve into the various autoimmune encephalitis syndromes, their underlying mechanisms, diagnostic approaches, and treatment modalities. Neonatal meningitis presents unique challenges due to the vulnerability of the infant's immune system. The lecture will cover the most common pathogens responsible for neonatal meningitis, including Group B Streptococcus and Escherichia coli. Moreover, we will discuss the challenges in diagnosing and managing this condition, considering the different causative agents and their specific treatment approaches. Tuberculous meningitis is a form of meningitis caused by Mycobacterium tuberculosis, the bacterium responsible for tuberculosis. Diagnosing tuberculous meningitis can be challenging due to its atypical presentation and the limitations of traditional diagnostic methods. This lecture will explore the diagnostic dilemmas associated with tuberculous meningitis and the advancements in diagnostic techniques that aid in identifying this form of meningitis. Herpes simplex virus encephalitis is a severe form of viral encephalitis caused by the herpes simplex virus type 1, HSV1. This lecture will discuss the clinical features that distinguish herpes simplex virus encephalitis from other types of encephalitis. Furthermore, the treatment options, including antiviral medications, will be covered along with the importance of early intervention in improving patient outcomes. Aseptic meningitis refers to cases of meningitis where no bacterial pathogens are detected. This lecture will focus on the various viral agents responsible for aseptic meningitis, such as enteroviruses and arboviruses. Additionally, we will discuss the importance of differentiating aseptic meningitis from non-infectious causes such as drug reactions and autoimmune diseases, highlighting the diagnostic approaches and management strategies. Viral meningitis outbreaks can occur in communities and pose significant challenges to public health. This lecture will explore the surveillance and control strategies employed to prevent and manage viral meningitis outbreaks. We will discuss the importance of laboratory diagnostics, epidemiological investigations, and public health interventions in minimizing the impact of these outbreaks on the population. Neuroimaging plays a crucial role in the diagnosis and management of meningitis and encephalitis. This lecture will delve into the interpretation and utility of neuroimaging techniques such as computed tomography, CT, and magnetic resonance imaging, MRI, in identifying characteristic findings associated with these conditions. Furthermore, we will discuss the role of neuroimaging in guiding treatment decisions and predicting patient outcomes. Immunocompromised patients, such as those with HIV/AIDS or undergoing immunosuppressive therapy, are at an increased risk of developing meningitis and encephalitis. This lecture will address the special considerations and challenges faced in managing these infections in immunocompromised individuals. Additionally, we will discuss the tailored treatment approaches and preventive measures specific to this vulnerable patient population. Meningitis and encephalitis can have long-lasting neurological sequelae, even after successful treatment. This lecture will shed light on the potential long-term complications of these conditions, such as cognitive deficits, epilepsy, and movement disorders. Furthermore, we will explore the mechanisms underlying these sequelae and discuss strategies for managing and improving the quality of life for affected individuals. In conclusion, meningitis and encephalitis present diagnostic and therapeutic complexities with potential long-term impacts. This lecture aimed to provide a comprehensive understanding of these conditions, empowering you to contribute to their early detection and management in your medical practice. Thank you for your attention, and please ask any questions.